Hello, I am Dr. Parvez Ahmad Rishi and this is presentation for medical student. Today's topic is Meniere's disease. It is also called as endolymphatic hydrops, disorder of the inner ear where lymphatic system is distended with endolymph. It is characterized by vertigo, sensorineural hearing loss, tinnitus, and oral fullness. Pathology. The main pathology is distension of endolymphatic system, mainly affecting the cochlear duct, scala media, and the saccule, and to lesser extent the utricle and the semicircular canal. The dilatation of cochlear duct is such that it may completely fill the scala vestibuli. There is marked bulging of Reissner's membrane, which may even herniate through the helicotrema into the apical part of scala tympani. This distended saccule may come to lie against the stapes footplate. The saccule and the utricle and saccule may show outpouching into the semicircular canals. Etiology. The main etiology in Meniere's disease is distension of endolymphatic system due to increased volume of endolymph. This can result either from increased production of endolymph or its faulty absorption or both. Normal endolymph is secreted by stria vascularis, fills the membranous labyrinth and is absorbed through the endolymphatic sac. The exact cause of Meniere's disease is not known. Various theories have been postulated. Defective absorption by endolymphatic sac. Normally, endolymph is carried by endolymphatic duct to sac where it is absorbed. Defective absorption by sac may be responsible for raised endolymph pressure. Experimental obstruction of endolymphatic sac and its duct also produces hydrops. Ischemia of sac has also been observed in cases of Meniere's disease underlying sac surgery, indicating poor vascularity and thus poor absorption by sac. Distension of membranous labyrinth leads to rupture of Reissner's membrane and thus mixing the perilymph with endolymph, which is thought to bring about an attack of vertigo. Vasomotor disturbance. There is sympathetic overactivity resulting in spasm of internal auditory artery or its branches, thus interfering with function of cochlear or vestibular sensory neuroepithelium. This is responsible for deafness and vertigo. Anoxia of capillaries of stria vascularis also causes increased permeability with transudation of fluid and increased production of endolymph. Allergy. The offending allergen may be a foodstuff or an inhalant. In these cases, inner ear acts as the shock organ, producing excess of endolymph. Nearly 50% of patients with Meniere's disease have concomitant inhalant and or food allergy. It is possible that Meniere's disease is multifactorial, resulting in the common endpoint of endolymphatic hydrops with classical presentation, sodium and water retention, excess amount of fluid or retained leading to endolymphatic hydrops. Hypothyroidism. About 3% of cases of Meniere's disease are due to hypothyroidism. Such cases benefit from thyroid replacement therapy. Autoimmune and viral etiologies have also been suggested on the basis of experimental laboratory and clinical observation. Clinical feature: age and sex. Disease is commonly seen in age group of 35 to 60 years. Males are affected more than females, usually. Disease is unilateral, but the other ear may also be affected. After a few years, cardinal symptoms of Meniere's disease are episodic vertigo, fluctuating hearing loss, tinnitus, sense of fullness or pressure in the involved ear. Vertigo, it comes in attack. The onset is sudden. Patient gets a feeling of rotation of himself or his environment. Sometimes there is feeling of to and fro or up and down movement. Attacks come in clusters with periods of spontaneous remission lasting for weeks, months or years. Usually an attack is accompanied by nausea and vomiting with ataxia and nystagmus. Severe attack may be accompanied by both by other symptoms of vagal disturbance such as abdominal cramp, diarrhea, cold sweat, pallor, bradycardia. Usually there is no warning symptom of an oncoming attack of vertigo, but sometimes the patient may feel a sense of fullness in the air, change in character of tinnitus or discomfort in the ear which herald an attack. Sometimes cases of Meniere's disease show Tullio phenomenon. It is condition where loud sound or noise produces vertigo and is due to distended saccule lying against the stapes footplate. This phenomenon is also seen when there are three functioning windows in the air, example fenestration of horizontal canal, in the presence of mobile stapes. Hearing loss. It usually accompanies vertigo or may precede it. Hearing improves after the attack and may be normal during the periods of remission. This fluctuating nature of hearing loss is quite characteristic of the disease. With recurrent attack, improvement in hearing during remission may not be complete. Some hearing loss being added in every attack leads to slow and progressive deterioration of hearing, which is permanent. Distortion of sound. Some patients complain of distorted hearing, a tone of particularly frequency may appear normal in one ear and of higher pitch in the other, leading to diplacusis. Music appears discordant. Intolerance of loud sound. Patients of Meniere's disease cannot tolerate amplification of sound due to recruitment phenomenon. They are poor candidates for hearing aid. Tinnitus. It is low-pitched, roaring type and is aggravated during acute attack. Sometimes it has a hissing character. It may persist during periods of remission. Change in intensity and pitch of tinnitus may be the warning symptom of attack. Sense of fullness or pressure. Like other symptoms, it also fluctuates. It may accompany or precede an attack of vertigo. Other features: patients of Meniere's disease often show signs of emotional upset due to apprehension of the repetition of attacks. Earlier, the emotional stress was considered to be the cause of Meniere's disease. Examination. Otoscopy. No abnormality is seen in the tympanic membrane. Nystagmus, it is seen only during acute attack. The quick component of the nystagmus stores the unaffected air. Tuning fork, they indicate the sensorineural hearing loss. Rennie's test is positive. Absolute bone conduction is reduced in the affected ear and Weber is lateralized to better ear. Thank you very much. please like and subscribe. If you want a particular video about a particular disease, please write in the comment. If you want me to make some videos on some particular topic, on some particular chapter, kindly comment in the comment section below. I will try to make such video. Thank you. Please like and subscribe, and that will be great help to the channel. Bye bye.